Yeah, I mean that's a huge question. Obviously, I think that, you know, at the moment it's very clear that access to most innovative therapies, you know, is a source of disparity. Entry into clinical trials, there are disparities there, and those disparities go beyond, you know, the ones that we normally think about, ethnic and racial minorities, but into areas such as rural populations and their access to care. I mean, in terms of how we iron those out, I think that's a massive subject, and it's partly educational, it's partly more robust funding systems, and honestly I think it's partly electronic. I think the solutions to these largely are going to require kind of more sophisticated software platforms for communicating with our patients than we have right now. I think to some extent they will. You know, I think access to clinical trials probably has improved in recent years. I think the likelihood is that it will continue to improve. But I think, you know, there are so many issues that we don't fully cover. I mean, culturally sensitive and culturally competent kind of information about studies, understanding, you know, the different cultural challenges that there are towards clinical trials in, for example, some populations that don't have a word for cancer in their vocabulary, and there are some. And, you know, so I think that some of these educational challenges that we have are the really big ones, but I think the new guidance will be helpful.